Gynecomastia. Generally, it is believed that elevated estrogen leads to gynecomastia in men. However, there are other factors that should be considered. Elevated prolactin. Prolactin is a hormone that is produced by the pituitary gland. It is responsible for milk production in women who are breastfeeding. However, prolactin can also be produced in men, and high levels of prolactin can cause a number of problems, including gynecomastia. Androgens. Too much of certain androgens, such as testosterone, can also cause gynecomastia. Testosterone's conversion to estrogen poses a risk. It is imperative to check estrogen levels while on TRT. Thyroid hormones. Hypothyroidism is a condition in which the thyroid gland produces too much thyroid hormone. Hypothyroidism can cause gynecomastia by increasing the production of estrogen. Hypothyroidism causes an increase in SHBG, sex hormone binding globulin. SHBG binds to testosterone preferentially over estrogen. In fact, SHBG has a higher affinity for testosterone than any other steroid hormone. This means that SHBG will bind to testosterone more tightly and with greater preference than to estrogen. This leads to more free-floating estrogens that are biologically active. More biologically active estrogen poses a greater risk for development of gynecomastia. Testing for SHBG can give us an insight into bioactivity of dihydrotestosterone, estrogens, and testosterone. If too high or too low, it can be useful in detection of other hormonal abnormalities and/or medical conditions. Hypothyroidism. How does hypothyroidism pose a risk for gynecomastia? Hypothyroidism can cause an increase in prolactin levels by increasing the production of thyrotropin-releasing hormone, TRH. TRH is a hormone that stimulates the production of prolactin. When TRH levels are elevated, prolactin levels can increase. Another way that hypothyroidism can pose a risk for gynecomastia is by causing a decrease in testosterone levels. Testosterone is a male hormone that inhibits the growth of breast tissue. Hypothyroidism can cause a decrease in testosterone levels by decreasing the production of gonadotropin-releasing hormone, GnRH. GnRH is a hormone that stimulates the production of testosterone. When testosterone levels are low, the growth of breast tissue is not inhibited, which can lead to gynecomastia. Growth hormone. Growth hormone is a hormone that is produced by the pituitary gland. It is responsible for promoting growth and development in children. However, too much or too little growth hormone can cause gynecomastia in men. This is very rarely seen, however, it needs to be part of the differential. In conclusion, there are 5 major factors that can lead to gynecomastia. 1. Elevated estrogen or a low testosterone to estrogen ratio. 2. Elevated prolactin. 3. Hypothyroidism or overactive thyroid. 4. Hypothyroidism or underactive thyroid. 5. Abnormal growth hormone levels. TRT causes a disruption in the hypothalamic pituitary axis and can lead to disruption of other hormones. It is imperative to obtain a comprehensive hormone panel prior and during TRT. Gynecomastia is a very undesirable consequence due to disruption of hormones as previously discussed. In most cases, surgical intervention is needed. As a result, preemptive measures should be taken to prevent gynecomastia. Does AI work once gynecomastia has set in? Aromatase inhibitors work best when gynecomastia is in its early stages. If gynecomastia has already been established, AI may not be as effective. However, AI can still be used to shrink breast tissue and improve the appearance of the breasts. AI are typically used for 6 to 12 months. If gynecomastia does not improve after 12 months of treatment, surgery may be necessary. Steroidal aromatase inhibitors. The most common steroidal AI is anastrozole, Arimidex. The most commonly prescribed AI with testosterone replacement therapy, TRT, is anastrozole, Arimidex. However, one must be careful not to overly reduce estrogen levels. This can lead to significant side effects. Low estrogen levels in men can cause a number of health problems, including erectile dysfunction. Estrogen helps to maintain blood flow, which is essential for erectile function. Loss of libido. When estrogen levels are low, libido can decrease. Fatigue. Estrogen helps to regulate energy levels. When estrogen levels are low, fatigue can occur. Severe depression can also occur.